Hi, my name's Emma and I'm a student on the MSc Counselling course at Bangor University, and this presentation is about my research into mindfulness in counsellors and the impact on relational depth. So I'm going to introduce the ideas first, mindfulness and relational depth, and then I'm going to take you through the hypothesis, method, results, some of the results and discussion, and then talk about what that might mean for practitioners. So I chose to study mindfulness. I've been practicing about 10 years, and when I started the master's course, I was really interested in finding out about how mindfulness practice might inform my counselling practice. So that's why I chose to focus on this area for my research. So mindfulness describes the ability to bring attention and awareness to experiences in the present moment with purpose, acceptance, and non-judgment. And there's already quite a lot of research about how mindfulness might be used within the therapeutic relationship. So there are third wave therapies such as acceptance and commitment therapy and dialectical behaviour therapy, which have incorporated mindfulness into the approach. But practitioners have also explored other ways in which mindfulness can inform therapy. And there's some examples there of texts and also in my reference list. So research has shown that therapists are applying mindfulness in their practice in different ways. They have been shown to have positive benefits for client outcomes and well-being, also positive impact on therapist well-being, and a positive impact on therapeutic presence. And mindfulness has been shown to be effective across therapeutic approaches, and that's regardless of the clinical qualifications or the experience of the counsellor. So some researchers have proposed that mindfulness, as it cultivates awareness and focused attention, could be a common factor which underlies that psychotherapy effectiveness. So it could be that the mindful qualities enhance presence by helping therapists to model factors which might be associated with increased relational depth. So this is how I came to look at the idea of relational depth. So relational depth is described as a feeling of profound contact with the client, and it's described as a merging of the core conditions where both therapist and client are receptive to create this experience of deep connection. And there's evidence of benefits both for clients and for therapists who experience relational depth. So clients have experienced better outcomes, and therapists have described a growth promoting relationship and improved motivation. And both clients and therapists have described it as a healing and transformative experience. And if you look at the research around therapist factors and what might facilitate relational depth, there's evidence that factors such as the ability to engage the client with openness and curiosity, and to bring a stillness and presence where their true selves can be encountered. So you can see some overlaps there with the ideas of mindfulness. So my research question was about, does mindfulness in counsellors increase relational depth with clients? So I used three measures to look at this. One was an ordinal scale, which we created to measure the level of formal mindfulness practice. So that's how long they've been practicing, months or years, how often they practice, the duration of each session. And also we asked about training, if they'd done any formal training in mindfulness. And then we used the 5-facet mindfulness questionnaire to measure the state mindfulness. So that measures observing, describing, acting with awareness, and non-judging and non-reactivity. And then the relational depth frequency scale uses a series of six statements to measure relational depth. So we had the first hypothesis was that counsellors with a higher level of mindfulness practice would have a significantly higher level of relational depth with clients than those who don't practice. And to test that, there was independent measures between groups design, where the independent variable is mindfulness practice and the dependent variable is relational depth. And that was tested by ANOVA. Hypothesis 2 was that there'd be a correlation between mindfulness scores measured by the FFMQ and increasing relational depth scores. And to test that, I used a Spearman correlational analysis, where the first variable was mindfulness score and the second relational depth score. It was a quantitative design, although we did have one question which asked people who practice mindfulness how they felt it impact their practice. So inclusion criteria were that participants had to be over 18, they had to be a qualified or a trainee counsellor, registered with a professional body and currently seeing clients. So we recruited through opportunity sampling and we asked the participants to complete the questions on relational depth, focusing on a current client with whom they'd completed at least 6 sessions. So some of the demographics and data about qualifications and experience of the participants are here. In summary, we had 53 participants and they were split fairly evenly between students and qualified counsellors. The average age was 42 and the sample was fairly largely female and white. And most counsellors were humanistic or integrative in their orientation. So looking at the results, so hypothesis 1, of the 53 participants, 17 were in group 1, they did not practice mindfulness, and 36 did practice, split between group 2 and 3. The results showed no significant difference in the scores between the groups. So that was a no result. And then hypothesis 2, we showed a statistically significant positive correlation between the mindfulness scores and the relational depth scores. So in terms of interpreting those results, so hypothesis 1, we had no significant difference between those scores and the level of practice in people who practice mindfulness. So one explanation for that could be that relational depth is essentially no different to the core conditions of person-centered therapy. So there are critics of relational depth who say that that's the case. And since 90% of the participants were person-centered or integrative, the core conditions are represented across the sample. So it could be then, if that's the case, the construct of relational depth is not valid, and that would mean also that the hypothesis is not valid either. However, Benz and Cooper see the core conditions as an enabler of the depth of the connection to the client, and it differs in being described as a threshold phenomenon rather than a continuous experience. So it's either present or not in the encounter. So I made an assumption that relational depth does exist. So what were the other explanations for this lack of significant result? So it could be simply that the ordinal scale that we use to measure practice is not valid. So there wasn't a measure of quality of practice. There wasn't a measure of whether counsellors practice mindfulness before sessions. And there were no measures of informal practice, so that's just practicing in everyday life, which could raise the levels of mindfulness. So that was a confounding variable. And there was also a lack of consistency in the training and experience within the group who practice mindfulness. So all those things could confound the results. So looking at hypothesis 2, that showed that there was a significant positive relationship between mindfulness score and relational depth, and therefore that is evidence that mindful states can increase relational depth in the therapeutic relationship. So thinking about how might that happen, what would explain that result, that relationship between mindfulness and relational depth? If we look at how these concepts of mindfulness and relational depth overlap, and some evidence from the participant comments, we can see that there are parallels between the qualities that are cultivated in both ways of being. So some examples of that are with mindfulness, the quality of observing and presence and being fully present with all experience. In relational depth, it's talked about being open and receptive to what is in the moment. And participants talked about being better able to be present in the moment with the client. And then thinking about, for example, decentered awareness. So that's another quality of mindfulness which enables congruence with essential self, is how it's been described in the literature. And obviously that has overlap with the idea of congruence with our essential being in humanistic therapy. And then participants had commented about more of their essential self is available for the work. So that's consistent with these overlaps between these concepts. And then if you look at the common factors within the mindful approach to counselling and an approach that cultivates relational depth, you can see that this idea of connectedness brings this together. So a mindfulness approach facilitates awareness, acceptance and compassion towards the therapist's own self states as a witnessing. And this has been likened to a moment of shared conscious presence. So there's a Buddhist idea of interbeing, which is this awareness of the interdependent nature of all things. And this description of connectedness also accords with research that suggests that relational depth is an experience of connection to self, while at the same time connecting to another. And if we look at participants and how they described it, so there was a comment inviting a client to be present with their thoughts, offers depth to the therapy over time and greater potential for understanding of oneself, leading to improved compassion and awareness. So what does it mean for practitioners who want to integrate mindfulness into their approach? As I mentioned at the beginning, there's quite a number of books and different research on mindfulness and therapy. This is Germer describes 3 ways in which mindfulness can be integrated into therapeutic work. And there were examples of each of those in the participant responses. So one way is using mindfulness to cultivate therapeutic presence. So the counsellor described it helps to ground before sessions and helps to stay with the client's narrative as they're telling it. And then being a mindfulness informed practitioner, so that's using it more as a relational understanding of mindfulness within the relationship. So participant talked about helping to bracket off the process and to be more open to experiencing others. And then the mindfulness-based counsellor, so in addition, therapists actually use within the session with clients, so recommending techniques to clients or using mindfulness exercises together. So in terms of it, what this means for practitioners, it does contribute to an existing body of research on benefits of mindfulness for trainees and for qualified therapists. So training in mindfulness could offer students, for example, an opportunity to experience the practice of being along the doing of practical skills training and tools. There's also research into the risks of integrating mindfulness into therapy in unskillful ways, and there's been highlighted the lack of research in this area, so there could be further research into that. There are best practice guidelines for the responsible integration of mindfulness, and that should be an essential part of any mindfulness training, particularly looking at potential risks, since mindfulness is not appropriate for everyone. So, and another idea for future research is to well, have a larger and more diverse group of participants. So this was a fairly small study and quite non-diverse, looking at yeah, other cultures, and also to include client perspectives in the research, which would enhance understanding because this only looked at therapists. You could also look at how therapists who practice mindfulness incorporate this in their work. So what are the different ways of practicing mindfulness, using it before sessions, in sessions, and what are the risks and best practice. So deeper research into that. And you could also look at different forms of meditation. So for example, compassion meditation, and what's the optimum amount of practice. So we could also look at neuroimaging. So to look at changes in brain activity during moments of relational depth and during mindful states to see if it's the same areas of the brain. And that would help us understand this, whether the merging of these concepts and connectedness. So in conclusion, the studies have provided some limited evidence that mindfulness in counsellors can increase relational depth with clients. We know there are many factors which impact the relationship between the client and the therapist. So mindful practice may mediate that deep interconnectedness through impact on any of those factors, including the core conditions. But what we're actually trying to measure is these experiences that really are beyond words. So it might be that these things are just beyond measure. So thank you for listening. I'm happy to answer any questions in the comments. I'm just going to quickly flick through my references, and thank you for listening.